614 cases have been reported in the last 24 hours, which is the highest since May this year. 21 of these cases are of the latest JN.1 COVID variant, which was first identified in Kerala and is behind the surge in cases in US, Singapore and China. Now, masks have been mandated in Chandigarh at the crowded locations. In Karnataka, testing has been ramped up. Karnataka Chief Minister Siddaramaiah is also going to chair a meeting on the overall COVID-19 situation in the state today. Masks for the elderly have also been mandated. Now, the highest number of JN.1 cases have been traced in Goa. 19 cases of the JN.1 have been reported, with Chief Minister Pramod Sawant saying that there is no need to panic. Well, just a day earlier, the Health Minister chaired a meeting on this and, of course, stressed over holding mock drills in all the hospitals. He also urged the states to ensure preventive measures are taken. Gurpreet, my colleague, is joining us on the broadcast to give us more details. Gurpreet, talking about the COVID situation in the nation, 614 cases have been reported in the last 24 hours, which is in fact the highest since May this year. What is this condition in Punjab? Because if we talk about Chandigarh specifically, masks have been mandated in crowded areas.
Well, yes, we have seen Punjab government has already taking precautions, and they have already given direction to all the hospitals, and they have also appealed to all the patients that if they face any type of health issue, specifically if they are going to find out a cough and fever, immediately they should report to the local hospital. But if we can talk about the specifically Chandigarh, we have seen the advisory has already been issued to all the residents of Chandigarh. They have given the precautions measure that they should not go to the crowded place and they should avoid the crowded place, because the way once again these cases are coming up nationwide, this is the alarm for each and every state. And what we can understand, the Chandigarh administration has already taken this step, and they have make it mandatory for the resident. They should wear the mask so that it should not further spread. But if we can talk about Punjab also, what we have learned from the sources also, all the precaution measures have been asked to all the hospitals, and they have also advised that they should advise to the patient that they should not go to the crowded place. So let's see that how the state governments are going to combat with this once again this virus which has already been started spreading. But as of now, what we can understand, Chandigarh administration has made it mandatory that they should wear the mask and they should avoid the crowded place, and if they want to go to the crowded place, they should wear the mask. So let's see that how in the coming days their precautions, more precautions are going to be taken by the administration and the state governments.
Neha, my colleague, is joining us this time from Bengaluru. Neha, if we talk about Karnataka, well, there are a few measures that are in place, and the Chief Minister Siddaramaiah is also slated to chair a meeting on the overall COVID-19 situation. Help us with more details on that.
Well, that's right. In fact, we're seeing that ever since, there has, of course, been a slight concern in the number of cases being reported from Kerala. The state of Karnataka, too, of course, has been preemptive. They've taken measures here. We're seeing border surveillance has already begun. In fact, the health minister has, of course, gone on to further reinstate that the testing would go up to about 5,000 per day. And also, more importantly, we're now going to be seeing that the technical advisory committee, in fact, would be meeting the chief minister today to try and ensure that those norms which the union government has laid down are implemented thoroughly on ground. Now, this could be simple things like masking in public places for people over the age of 60, or other measures as far as the border surveillance is concerned. Another, of course, talking point at the meeting would be the fact that we are going to be seeing mass celebrations, mass gatherings happening during the time of Christmas and New Year, and that, of course, shouldn't become a cause for spreading of the virus. And that's something also that's going to be discussed. But on the whole, one thing that's quite certain is that the government has assured people in the state of Karnataka that there's no need to panic at this point in time.